Thank you very much, everybody. Today, the United States is launching enhanced counter-narcotics operations in the Western Hemisphere to protect the American people from the deadly scourge of illegal narcotics. We must not let the drug cartels exploit the pandemic to threaten American lives.
To conduct these enhanced operations, the President has directed the deployment of additional ships, aircraft, and security forces to the United States Southern Command area of responsibility. Included in this force package are Navy destroyers and littoral combat ships, Coast Guard cutters, P-8 patrol aircraft, and elements of an Army Security Force Assistance Brigade. These additional forces will nearly double our capacity to conduct counter-narcotics operations in the region. Additionally, 22 partner nations have joined us in this fight, bringing with them a variety of intelligence and operations capabilities needed to defeat these criminal organizations.
And we're looking at doing 2 additional brand-new hospital ships because these ships have really, they've really struck a blow, very positive blow for what they're doing, going to Los Angeles, going into New York. So we're looking very seriously at building 2 additional ships. States are different, and I understand that Governor of Florida, great governor, Ron DeSantis, issued one today, and that's good, that's great. But there are some states that are different. There are some states that don't have much of a problem. There are some, well, they don't have the problem. They don't have thousands of people that are positive, or thousands of people that even think they might have it, or hundreds of people in some cases. So you have to look. You have to look at states. You have to give a little bit of flexibility. But if a state in the Midwest, or if Alaska, as an example, doesn't have a problem, it's awfully tough to say, close it down.
If we get to the part of the curve that Dr. Burke showed yesterday, when it goes down to essentially no new cases, no deaths at a period of time, I think it makes sense that you're going to have to relax social distancing. The one thing we hopefully would have in place, and I believe we will have in place, is a much more robust system to be able to identify someone who's infected, isolate them, and then do contact tracing. Because if you have a really good program of containment that prevents you from ever having to get into mitigation, we're in mitigation right now. That's what the social and physical distancing is. The ultimate solution to a virus that might keep coming back would be a vaccine. In fact, I was on the weekly conference call with the WHO-sponsored group of all the health leaders in the world who are dealing with this. And we all came to the agreement that we may have cycling with another season. We'll be much better prepared. We likely will have interventions. But the ultimate game changer in this will be a vaccine. I mean, the vaccine is, as I said, it's on target. We're still in phase 1. There were 3 doses that we had to test. We've been through the first 2 doses. We're on the highest dose now. When we get that data, it'll take a few months to get the data to feel confident to go to the phase 2. And then a few months from now, we'll be in phase 2. And I think we're right on target.
And so I've really called on every university and every state to develop ELISAs. You can buy the antigens and the controls online and really work to test entire healthcare communities in your states and support them that way. At the same time, we worked in sub-Saharan Africa on what we call dried blood spots. So we're looking at, could you use that in a community while we work on the point of care test, where you just dot blood onto this paper, and then that can go into the lab and be analyzed. That would allow us to look in nursing homes and other long-term care facilities immediately.
All across America, we have Medicaid for underprivileged Americans. And at the President's direction, the Center for Medicaid and Medicare Services has given unprecedented waivers for states to expand coverage for coronavirus testing and treatment.
I am looking where flights are going into hotspots. Some of those flights I didn't like from the beginning, but closing up every single flight on every single airline, that's a very, very, very rough decision. But we are thinking about hotspots where you go from spot to spot, both hot.
Should we be wearing masks out? We've heard lots of different recommendations.
I don't believe, look, there's a big thing, a lot of people don't like it. Some people don't like it because you're taking it away from the medical professionals. Some people don't like it for other reasons. I don't see where it hurts, and it doesn't have to be a mask. It can be a scarf. Scarf is highly recommended by the professionals. I don't see where it hurts. I think, frankly, if people wanted to do it, we don't want to do anything that's going to take masks. You're talking about a tremendous amount of masks when you do that. We don't want to take them away from our medical professionals, but I certainly don't see it hurting. But what I do see people doing now is using scarves. And I think in a certain way, depending on the fabric, I think in a certain way a scarf is better.
Joe Biden would be open to having a phone call with you to talk about the coronavirus
That's
pandemic.
okay, sure.
Would you take his call? Would
Oh,
you,
absolutely.
You would talk to him about
I'd love to
it.
speak to him, sure. I'd mean,
How do you
he should
think
be
you
able
work
to.
together?
I always found him to be a nice guy. I don't know him very well, frankly, but I think he's probably a nice guy. No, if he'd like to call, I'd absolutely take his call.